Here we see how a patient who developed psoriasis at an early age and underwent multiple treatments with little benefit was able to reverse the health problem by correcting lifestyle. Psoriasis is considered to be a chronic autoimmune disease. This disease happens when the body's defense mechanism, which is the immune system, attack and destroys its own cells, skin, nails, joints, etc. In modern medicine, psoriasis is treated with the drugs that suppress the immune system. Even with timely and regular medication, often the disease is not reversed and often it is difficult to control. Skin irritations, redness, inflammation, and increased shedding of the skin. Very often, along with the physical challenges, the associated mental stress exhausts the patient. How was an 18-year-old female patient who had psoriasis, fatty liver, obesity, mental stress and depression able to taper off medicine for multiple conditions with the clinically supported lifestyle correction and the importance of lab tests in evaluating the progress of treatment, which was essential to reduce, taper and stop medications based on the progress of the body parameters. Also, we get a picture of the time required for treatment and the time required to show improvements and subsequently reverse the symptoms like itching, redness, swelling, inflammation and shedding of the skin. This series is about my experience with the patients who took clinically supported lifestyle correction to avoid surgery and taper off medications. This can help you understand how valuable are the lifestyle corrections needed for overcoming any chronic lifestyle disease. Most importantly, what advantages such an approach has when deciding on undergoing surgical procedures or continuing with lifelong medications. To know more about different lifestyle diseases, treatment options, reversal of lifestyle diseases with lifestyle modulation, etc., you may search our healthcare channel. When we come to the details of this patient, she's a 18-year-old lady, height 154 centimeters, weight 67 kg. She is suffering from psoriasis for the last 2 years. And she has tried different skin specialists in the modern medicine and also the other systems of medicine like Ayurveda, Homeo, Unani, etc. that is also prevalent in our part of the country. Those modalities of treatment is very well accepted here. But with everything they had tried, but not of much benefit. Actually, initially she was tried with English medicine, that is modern medicine. Then she's tried the other Homeo, Ayurveda and all. Then again, last 1 year, she's coming to me, she's taking the English medicine, modern medicine itself. Then what were her discomforts were mainly itching, that is the skin, all over the body itching and the scaling and the redness and raised patches. That is typical of psoriasis patient. And it is covering almost 50% of the skin actually. She's usually the psoriatic patients, they wear full sleeve dress and it's all covering. Even though the neck and the face also some lesions were there, but the body just much more. Initially we will not feel that much. Only when you are looking into the body parts, we will be able to see the extent of the disease. And she had naturally, it's a young girl actually. She's suffering from all these problems and she was very stressed and depressed also. And when we come to the family history, actually her father didn't have any problem. Mother has some skin lesions, redness and all, but not of this extent or cannot take it as a psoriasis. Some more problems, that's all. And her siblings also doesn't have any skin problems. When we come to the initial patient assessment, her symptom-wise, before starting or when she comes, her problem is symptom-wise itching, scaling and redness of the skin, raised patches, hypopigmentation and stress and depression. So, physical problems is there, mental problems is there. And she was on methoxycillin, that is one immunosuppressive sort of tablet, and also so on ointment also she supplied. But even if she is taking it was of not much benefit, it is body is severely affected, the discomforts are continuing. And the test reports actually, usually we do a detailed test, but only very few tests were abnormal in her case. The uric acid level is high It can be because of the turnover of the psoriasis is a problem where the cell turnover is very fast. Usually the external skin epidermal cells, it take 4 weeks for the turnover. That is, today when cell is starting developing, it will fall off after 1 month, almost 4 weeks. But in psoriasis, it will fall off by 4 days. Within 3-4 days, it will fall off. That is the reason it is that scaling and skin shedding of the skin is happening. So because of that, maybe this uric acid is high. Another reason is it is an autoimmune disease, so the kidney may be affected. Kidney can also be affected, let's say autoimmune nephritis and all, so it's very common. If one autoimmune disease comes, other organs also can get affected. And her vitamin D level is very low. The skin is the organ which is producing vitamin D. Naturally, if the skin is diseased, and the vitamin D level can be very low. And her vitamin D was only 70. And the allergic responses also we look into. But her IgE level is increased, but not that much. 277 was the IgE level. And her eosinophil level, that is also we specifically look into, because itching and whether it is what sort of allergic reaction. Actually, eosinophil level also is normal only. WBC, general inflammatory level is very high. W, not very high, but it is marginally high, 10.16. And another aspect we look into is allergy and intolerance, what the food and inhalants, contact allergy, etc. Many of the factors, the commonly used food in our area in Kerala, it is banana. Is different type of banana fruit is available. That is a major fruit in our part of the country actually. So banana is she's allergic to, and capsicum, tomato, vinegar, chicken. That is also the most common meat item usually used by the non-vegetarians here. And many of the inhalants also is she is allergic to. And another thing is she's intolerance also. She's allergic to milk and milk product. Most of the milk products, egg, and some pulses also. Peas, she's allergic, and many nuts. So many. I'm not elaborating into that because it will be different for each person. So we have to consider, whenever we are considering this lifestyle disease, there will be, lifestyle means food and physical activity and the atmospheric factors. So, and the mental activity also. So definitely this food we have to look into, and we have to find out which food is suitable for the body also. We are taking, whether it is vegan, vegetarian or non-vegetarian, whatever is, we are actually finally, the food taken is this nutrients. Finally, it is turned into nutrients, whether it is non-vegetarian food or vegan food. It will be the final, the need of the body for the human body is the same. And that is around 57 nutrients, which is essential for the body, that is internationally accepted, including oxygen and water. It includes definitely oxygen, water, then 14 vitamins, 14 minerals, around 20 amino acids, and 4 fatty acids, out of which 2 is essential, omega-3 and omega-6, and carbohydrate and dietary fiber. In this autoimmune disease, the actually immune system is controlled by the omega-3 and omega-6 fat. One of the main point we look into with clinically supported lifestyle correction also, to correct the omega-3-6 balance inside the body, not in the food, and also at the body level, the fat omega-3-6 ratio should be corrected, and that the cellular level also omega-3-6 ratio should be corrected, because almost all the diseases are of inflammatory origin. This autoimmune diseases is the body. Its immune system is attacking our own cells. Here the inflammation is controlled by the omega-6, and actually this blocking the omega-6 fatty acid pathway, that is the major role of this all immunosuppressants. And the omega-3 is actually balancing it, or it is anti-inflammatory. So increasing the omega-3 level, the body definitely will be having already the obesity is there, so body will be having so much of fat, and it will be more of omega-6. So we have to reduce the omega-6 fat, and let's try to increase the omega-3 fat. That is one aspect of it. Next is, what was her body position, what is body's situation or body composition in the beginning. She's only 154 centimeters, but her weight is 67 kg. So that's only 18 years also. So she's obesity is there. BMI is 28.5. Actually, for Indians, the upper BMI should the BMI should be 18 to 23. If it is more than 23, it is considered as 23 to 25 is considered as overweight, and above 25 is considered as the obesity. So she is in the obese level actually. BP, even though she is not taking any, not diagnosed with BP, her BP is also high. She is having metabolic syndrome, BP started, hypertensive also. Abdominal obesity is there. Her abdominal circumference are 89, almost 90 centimeters. And body age, she's only 18, but her body age is 39. So accelerated aging. So imagine she's the double, more than double her body age actually. And fat percentage is 36.5. She should be ideally around 15 to 20, maximum 25% fat only at this age. And now it is 36 points, more than double the fat content. So this fat is actually acting as a toxin, especially, as I said, this omega-3-6 balance must have been gone also. Next is the scan report. Actually, usually we do an ultrasound scan of the abdomen also to see what is the internal organ situation. Ultrasound scan is harmless. It doesn't have any side effects. So you can know about the genital organs, uterus, liver, kidney, pancreas, intestinal pyramid. And we'll get a lot of information by an ultrasound examination. And her ultrasound examination showed fatty liver and fatty infiltration of the liver with it is grade 2 fatty liver. So at this young age, she is having fatty liver also. So when we come to the diagnosis, she is having psoriasis, obesity is there, fatty liver is there, grade 2 fatty liver, and psychological problems like mental stress and depression is there. Then the disease category, what type of disease it is? It is actually, one is the autoimmune. Psoriasis is basically an autoimmune disease, and the metabolic syndrome also is there. So the fatty liver and obesity and hypertension is of the metabolic syndrome. Next, what is clinically supported lifestyle correction, or what is the difference between self-lifestyle correction and the clinically supported lifestyle correction? When everyone knows that this obesity and psoriasis, everything will be having some lifestyle factors is there. All the diseases has a lifestyle factor will be there, and a genetic factor and an environmental factors. So the genetic factors we cannot make any change, but we can by controlling the lifestyle factors or environmental factors, we can reduce the expression, or we can delay or stop the expression of the genetic situation. Or in this patient, she doesn't have any family history of or anything, but so it may be because of her excess fat and other lifestyle factors itself has produced this disease. So in clinically supported lifestyle correction, what we are trying to correct is to give the patient, or ensuring the patient to get optimal nutrition, optimal activity, and also reduce the toxin level in the body. So if they are taking medications, taper off the medicine with the improvements in the symptomatic improvements actually. Look into this patient. When we started this patient with the lifestyle correction, what was the progress? What was the changes what we got? See, symptom-wise, actually, her main symptom is of what the skin itching, redness, scaling, patches, and these problems. So it is almost 90. The itching is almost gone by the 8th day when she comes. Usually the visits will be in the first day, or starting day 1, then 8th day, and then 15th day, then 30 days, and every month, 60, 90, that is the pattern of visit. In between, we follow the patient online, continuously with the phone and online communication. Then by the 15th day, actually, every symptoms she has reduced by the 8th day, and itching is almost gone, and she was very comfortable. And by the 15th day, the scaling also almost reduced. And by 30th day, redness and this patches and everything. And by 60 days when she comes, she was almost symptom free. Only thing that initially they were hypopigmented. These patches are more of hypopigmentation. That her face and neck and all patches, it is more on hypo. It will look like something like a vitiligo. Initially, immediately when we see whether we'll consider whether it is vitiligo, some of the patches. The other reddish patch, we know that we can evidently psoriatic, but that was the initial stage. But those patches as darkening was there. That is a part of the healing actually. So otherwise her skin was come to almost normal by the 60 days itself. Next, when we consider about the medications was actually stopped by the 8th day itself, because we asked her to stop the ointments and all which she is supplying, and has given special nutritional oil with very high omega-3 and vitamins which can be which can be absorbed directly from the skin itself. So that is playing a very important role. This skin care support is playing a very good role in this skin problems actually. So it is not only the oral food, nutrition is reaching the skin directly from the nutritional oil also. So because of her symptoms are reduced by 8th day, she stopped this other tablet also. Next, when we come to the blood reports, actually uric acid level was actually increased initially. The 30th day and 60th day, this uric acid level was slightly increased. That is because of the turnover. When the body turnover of the cells is increasing, there can be uric acid can be increased because the metabolic waste from this DNA of the cells and all has to be excreted. In such cases, when the uric acid is increased, we don't go for uric acid reducing agents or anything like we don't give that. Instead, we ask them to take more water so that there should not be any difficulty for the kidney to excrete the uric acid and should not crystallize in the urine to make uric acid crystals or urinary stone. So anyway, by the 90th day, her uric acid level has come down to by the 60th day, her uric acid level has come down to normal. It is almost to the normal, 6.2. Next, vitamin D was low. It was corrected by the 30th day, that is with the supplements also. And we had to, vitamin D will be low because it is her skin is affected. Definitely the vitamin D can be affected. And another important thing was the WBC count was high and it just came down to normal by the 30th day itself. Next, when we come to the body parameters, her body weight, that is the major thing, it is she has 67 kg, and by the 30th day itself, she is able to almost reduce 10% of the body weight, 67 to 59.8. By next to the by day 60, it was 57.8. So it came down to 57.7, and BMI also from 28.5 to 24.6. But she has to reduce further. And BP was high, and it is came by the 30th day itself. It is BP was normal, 170. Abdominal circumference is reduced from 89 to 80 in the first month itself, and 77 by the second month. And body is 39 to 34 by 1 month itself. 5 years reduced. And next, after the first month, the result was weight reduction and was very fine. By the first month itself, she was so comfortable. The symptomatic relief was there, so the patient's efforts was reduced in the weight reduction. That's why actually in the second month she didn't get much, only 2 kg. But the initial first month is 7 kg. Second month she would have get at least 5 kg reduction, but that is slightly reduced. She had some exam or something like that, so she was not able to concentrate on her exercise. That is what was her excuse actually. And fat percentage also reduced from 36.5 to 35.6, but she has to reduce much more fat. So what is actually in the future, we are ideally she should come down below 50 kg, especially ideally she should at this age she should come down to 45 kg, and she's only 18 years. So, and the BMI should be ideally for the Indians 18 to 23 is the range. She should try to keep between 19 and 21. And BP definitely 120, 80, 110, 70, that will be the ideal. And for her height, she should reduce her abdominal circumference below 65. And body age, she should come down to 18 itself. This is accelerated aging, which is 39, it has to come down. And fat percentage preferably less than 25%. So that the patient has to take continuous effort for that. And when we consider this lifestyle correction, we should see what was the before and after. So before her lifestyle correction, she was symptomatic, and by the 15th day itself, she is almost symptom free, and by 60 days, the symptoms has almost gone. So that is the importance. For the last many years, she was trying to, with medications, different sort of medical systems, including Ayurveda, Homeo, modern medicine, skin specialist. But she was not able to get a symptom. She was never been symptom free. But with the lifestyle correction, she was able to become symptom free within 2 months itself, almost. Only that turning of hypopigmentation to hypopigmentation, that is the only change, and most probably by the 90 days, hypopigmentation also will be tallied into normal. In between, actually, she has taken one day. She took banana again. She's allergic to banana, and that day she herself was telling, after taking banana, she had a few itching spots and redness came. But after that also, if there some response or irritation of the skin occurs, we give immunosuppressant sort of ointment and a tablet if necessary, anti-allergic and immunosuppressants. Only for if the patient is consciously or unconsciously taking something which is against her body, like any allergic food or anything happens, and especially during life, we may not be able to follow all the parameters correctly because of the circumstantials. They may have to take something which having some food items which is against her tolerance. So in that stage, here also she has taken the immunosuppressant ointment, it immediately disappeared. Next, this medication. She is not taking any medication regularly, only if that is the advice given to the patient also. If they are not able to follow the lifestyle correction properly because of some circumstances, then if the symptoms start, immediately use the medicine and don't allow it to progress. So usually this applying a nutritional oil will be sufficient, and that has to be applied continuously till the skin is normal. And if an irritation like itching happens, immediately they can apply some sort of immunosuppressant ointment. That also will advise them. And if it is going extra abnormal, then take some tablet for 1 or 2 days. That will be sufficient actually. Next, about the blood parameters, it was corrected within almost within 60 days, 90 days, everything was normal, and it was continually normal also. Follow-up visits also, it was continually normal. Next, body composition. She was overweight. She has to, by 60 days only we are showing, but ideally she should come to around 45 kg. According to her height, it is only 153, 154 centimeters. She was obese. She was there 67 kg. It has to come down to, within 2 months he came down to 57, but she has to shed another at least 7 to 12 kg again. And BMI ideally between 18 to 21 he has to keep, and definitely BP maintain, and abdominal circumference also less than 60, 65, that will be ideal. And body age, it was reduced to 33, but around 6 years changes within 2 months, but further we had to work out and bring her body age to normal 18, that is the calendar age. Calendar age and body age should be matched. And fat level also to be reduced. Next, what we had to consider is, what will happen to her if she is continuing with the conventional medicines? The psoriasis is considered an incurable disease, and that is the modern medicine norms actually. You have to continue with the medication. And with this, the present level of medication, she was not getting control. So to get her, make her better, we had to go for the more medications like steroids or metabolites. Here we are doctors, usually that is the line of management. First line is ointments and other things, and then methotrexate. If she is so very young, that is why I think this dermatologist has not given methotrexate, because it is a growing age. But giving methotrexate will hamper this teenage growth time, which is not completed. So next is biologicals. That is, one is methotrexate, that is an anti-cancerous medication, that's an anti-metabolite. And next line is the biologicals. Biologicals means that is specifically targeting this immunological aspect, usually interleukin, anti-interleukin suppressants actually. So that is every month or month or two, within 1 or 2 months, newer this biological medicines are coming for different, especially for the psoriasis, psoriatic arthritis and all. And it will be, one is we don't know what are the future complications it can, because we are manipulating the immune system. Second is, it is very costly. The older ones may be costing around 10,000 per injection, and the newer ones is costing for 10,000. I am saying in the rupees, in our Indian rupees, it will be around 10,000. And if it is in the newer versions, it may cost you around 30 to 50,000. Different costs are available. So whatever is, immediately there may be, after injection there may be result, but after anyway the injection is not curative. It will be having effect, depends on the medicine for some time, maybe 1 week, 2 weeks, or 1 month, 2 months. After that, or maximum 6 months, it depends, remission can be there. And after that, again you have to repeat the injection. But after some time, this injection also will not be effective. Then we have to shift to another thing. So a newer one will come, we will try that. And that will be the pattern of treatment in this case. So we have to give additional medicines. Then what will happen for she is already having BP. She may have to take medication for BP. She is having fatty liver. There is no medication for fatty liver. But when we are taking the steroids or other immunosuppressant, then naturally there will be a weight gain tendency will be there. So weight will be increasing. She may get diabetes, and the hypertension can be increased. So go for other comorbidities also. So after anyway in years, she may get other autoimmune diseases like hypothyroidism, or can be getting kidney or the liver. Liver already is affected. Autoimmune fatty liver, then it can progress to autoimmune fatty liver, or because of the metabolic problem, NASH, non-alcoholic hepatitis, it can progress to cirrhosis, and that way liver failure and such things also can happen. Lungs can be affected, or allergy. Usually autoimmune the psoriatic patients can get allergic rhinitis, and so because of the immune system is affected, any disease can occur. Especially when we are taking immunosuppressant, the immunity is suppressed again. So the chance of infection and the chance of getting cancer also will be high. And because of these problems, future can many surgical or needs can come also. And always this sort of patients will be of a complex patient, because any injury or infection comes, there will be, because metabolic syndrome, obesity is there, autoimmune disease is there. So the recovery from the disease will be much difficult. But now she is not taking any immunosuppressants. She is not a sick person at all. Hypertension reversed, psoriasis reversed. She has to definitely bring down the obesity also. Obesity is not fully reversed, it has to be reversed fully. That is very important in this. So the importance here is, if you are continuing with the conventional method of treatment, the patient will be continuing as a patient always. Throughout life she will be a patient. When you are correcting the lifestyle and reversing the lifestyle disease, means you are coming out of the disease status itself. That is the important. That is what is the thing. Every patient, every lifestyle disease, this is possible. Not only for the psoriasis, eczema, or not this thing. Any other, the common diabetes, hypertension, that is all metabolic syndrome. Here also metabolic syndrome. This fatty liver. By 3 months we will be checking the liver again for what is the change. Usually the fatty liver grade 2 will be reduced to within 3 months to grade 1. And by 6 months, we are expecting the liver will be normal, or not the normal liver we are expecting, provided the patient is following the things correctly and reducing the weight also. And if the weight also is normalized, the fatty liver also will get normalized. Here, in clinically supervised and supported lifestyle correction, what we are trying to do is use the healing power of the body by empowering the healing aspect, the anti-inflammatory aspect of the immune system. First is by providing optimal nutrition. Second, by promoting removal of toxins by improving circulation through optimal stimulation of all cells by planned exercise. Third, minimizing toxins entering the body through food, water, air, and cosmetics. Diabetes, hypertension, heart disease, cancer, liver disease, kidney disease, obesity, stroke, allergies, autoimmune diseases, etc. come under the umbrella of lifestyle diseases. 90% of the medication and 90% of the surgeries are for lifestyle diseases. This means that 90% of the medicines and 90% of the surgeries can be avoided. It is good to understand that neither medicines nor surgery can cure a lifestyle disease. To put it differently, it is not a lack of medications nor surgery that created the disease. This is why once medication is started, very often both the diseases and medicines will keep on adding more numbers along with the unwanted side effects. This is why it is very important for you to understand and correct lifestyle while also encouraging others to do so. Another important aspect is when someone is talking about healthcare and treatment approaches, you should consider the scientific background of the concerned person. I'm Dr. Jolly Thomson, started medical education in Government Medical College, Kochi in 1981 and completed diploma and MD in obstetrics and gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine and surgery, joined government service. Later resigned from the government service and in 1997 started practicing as consultant at Life Care Center, Devara, Kochi, focusing on lifestyle modulation with the clinical support for lifestyle diseases, minimizing the need for medication and surgery. Another important thing, every patient should understand a patient's role in drug pollution. Major part of the medication we take are excreted in urine, sweat and stool. It will reach the groundwater, rivers, drinking water, plants, animals and food products. That means the medication we take is becoming a threat not only to us human but to all life forms on our planet. Therefore, it is essential to correct lifestyle, reverse lifestyle disease and come out of medications. To protect our children, grandchildren and the coming generations from the ill effects of toxic pharmaceutical pollution, we should come out of the dependence on medication. The current norm of chronic patients on lifelong medication has to change. Spreading awareness on reversing lifestyle disease and minimizing medication is the need of the hour. Therefore, remember to share this to your relatives, friends and colleagues who are on chronic medication or planning for surgery for lifestyle diseases. Thank you.